Okay. Check in with the medical record, verify the patient orders. It's a pMDI spacer with albuterol, and put on, or wash hands, put on the gloves. Knock, knock, knock. Is it okay if I come in?
Yes.
Hi, I'm Andrew with Respiratory Therapy. I'm going to go ahead, your physician asked us, ordered for you to get a pressurized meter dose inhaler with albuterol to help open up your airways when you have any of that asthmatic issue at home. Okay? Can I verify your name and date of birth?
Yes. Abuja, January 9th, 1990.
Right on. Thank you very much. Okay, so first of all, I'm going to get a quick listen. Make sure how we sound pre and post therapy. Get you to take some regular breaths for me. Thank you. Okay, thank you. All right. Record patient's SpO2, heart rate, and rate of respiration, as well as the breath sounds. And have you ever used a pressurized meter dose inhaler before? Okay. It's fairly simple. Medication comes in a little canister like this. It's inserted into this mouthpiece actuator, is what they call it. Before you ever use it, when it's brand new, or if you go, let's say you're well for a while, you don't need it, and it goes longer than 2 weeks, you'll want to shake it up, open it up, and depress it, and it helps prime it, clear anything that might not be the direct dosage or correct dosage that is. Shake it again, and that primes it. And like I said, if you're less than 2 weeks, you don't need to reprime it. But if you go longer, you do. And what this is a spacer. And instead of having to be so coordinated with when you depress the plunger and get it to come into your mouth and breathe it in correctly for deposition in the lungs, or getting enough medicine correctly, this helps with that coordination issue with patients that are new to it. So you place this into the end of the spacer. The spacer then holds the medication. You can shake it before your first dose, depress, and then you make a nice tight seal with your mouth around the end. Inhale slowly. It will make a noise if it detects that you're inhaling too quickly. And all that says is just slow down a little bit. Try to go as deeply as you can. Then what you'll do after that is you'll wait about 30 seconds, shake it again, depress again, and inhale again. And that's the typical dosage. If you find that you're exceeding a given dosage that we set for you before you go, let us know. Call into the doctor's office and see if they can adjust the medication or whatnot. All right, and then what you do when you're done, you can disassemble it. You'll want to wipe this out with a clean cloth. Once this is clean, this can also be washed with cool water and soap. Same with the spacer. If you find that it's getting dirty, let it air dry. Oops. Want to give it a try?
Yes.
See how it feels? Okay. Make sure you got your mouthpiece off of there too. Yeah. And do a nice breath hold for me. When you do the slow, deep inhalation, I'm sorry, I forgot to go into that. You want to, at the end of the breath, each breath that you do, of the two, you want to do a nice 5 to 10 second breath hold at the peak of the breath. Good. That's good. Yeah. You don't need to, anything between 5 and 10, whatever's comfortable, should be adequate.